Hello and welcome. Today we're going to delve into a fascinating and potentially debilitating condition, neuritis of the auditory nerve, often linked to viral infections like herpes or cytomegalovirus, or CMV. While this primarily affects hearing, its connection to the nervous system can sometimes manifest with visual disturbances. Join us as we explore the causes, symptoms, diagnosis, and management of this complex disorder. The primary culprit behind auditory neuritis, or inflammation of the auditory nerve, is often a viral infection. Herpes simplex virus, the same virus responsible for cold sores and genital herpes, and cytomegalovirus, a common virus that can cause a range of illnesses, are frequently implicated. These viruses can directly attack and inflame the delicate nerve fibers of the auditory nerve. While less common, other viruses like measles, mumps, and rubella can also contribute. The auditory nerve is responsible for transmitting signals from the ear to the brain, enabling us to hear. When this nerve is inflamed, it can disrupt these signals, leading to various auditory problems. In rarer cases, it may be caused by an autoimmune response or even be idiopathic, meaning the cause is unknown. Let's discuss what happens in the body when auditory neuritis develops. When a virus infects the auditory nerve, it triggers an inflammatory response. This inflammation damages the myelin sheath, a protective covering around the nerve fibers. This damage disrupts the transmission of electrical signals along the nerve. This disruption leads to auditory dysfunction. In severe cases, the inflammation can cause permanent nerve damage. The body's immune system, while trying to fight off the virus, can sometimes contribute to the nerve damage through an autoimmune reaction. Auditory neuritis is considered a relatively rare condition. Exact numbers are difficult to obtain because it is often underdiagnosed or misdiagnosed as other hearing disorders. The incidence rate varies depending on geographical location and the prevalence of the causative viruses. Individuals with weakened immune systems, such as those with HIV/AIDS or those undergoing immunosuppressive therapy, are at higher risk. Children born with congenital CMV infection are also more susceptible. While it can affect individuals of any age, it is more commonly seen in adults. The symptoms of auditory neuritis can vary depending on the severity of the inflammation and the extent of nerve damage. The most common symptom is sudden hearing loss, usually affecting one ear. Tinnitus, or ringing in the ears, is also a frequent complaint. Dizziness or vertigo can occur if the inflammation affects the vestibular nerve, which is located near the auditory nerve and responsible for balance. In some cases, individuals may experience a feeling of fullness or pressure in the ear. It's important to note that due to the auditory nerve's proximity to the facial nerve, facial weakness can sometimes, although rarely, occur. Visual disturbances are not typical but can occur in rare cases due to the proximity of certain brainstem pathways. These visual disturbances are often subtle and may manifest as blurred vision, difficulty focusing, or sensitivity to light. Diagnosing auditory neuritis involves a thorough medical history, a physical examination, and several audiological tests. An audiogram, or hearing test, is crucial to determine the type and extent of hearing loss. Further tests, such as tympanometry, may be performed to assess the function of the middle ear. An MRI of the brain and inner ear may be necessary to rule out other causes of hearing loss, such as tumors or structural abnormalities. Viral antibody tests may be ordered to identify the causative virus, such as herpes simplex or CMV. These tests help doctors determine the presence of antibodies that indicate a recent or past viral infection. In some cases, a lumbar puncture may be performed to analyze the cerebrospinal fluid and rule out other neurological conditions. While there aren't specific subtypes or classifications of auditory neuritis in the same way there are for some other diseases, it can be broadly categorized based on its suspected etiology. This can include viral-induced neuritis, such as herpes or CMV-related. Idiopathic neuritis, when the cause is unknown, and rarely autoimmune-related neuritis. It's important to note that the identification of the specific cause can greatly influence the treatment approach. The primary goal of treatment is to reduce inflammation and prevent further nerve damage. Antiviral medications such as aciclovir or valacyclovir may be prescribed to combat viral infections. Corticosteroids, such as prednisone, are often used to reduce inflammation and swelling around the auditory nerve. In some cases, intravenous immunoglobulin, or a VIG, may be administered to modulate the immune system. If hearing loss is permanent, hearing aids or cochlear implants may be recommended to improve hearing. Vestibular rehabilitation therapy can help individuals cope with dizziness or vertigo. Early intervention and treatment are crucial to maximize the chances of recovery. Preventing auditory neuritis can be challenging, especially when the cause is a common viral infection. However, certain measures can help reduce the risk. Vaccination against viruses like measles, mumps, and rubella can prevent these infections from causing auditory neuritis. Practicing good hygiene, such as frequent hand washing, can help prevent the spread of viral infections. For individuals with weakened immune systems, antiviral medications may be prescribed to prevent opportunistic infections. Pregnant women should be screened for CMV and other infections to prevent congenital infections in their newborns. The prognosis for auditory neuritis varies depending on the severity of the inflammation, the underlying cause, and the promptness of treatment. Some individuals may experience complete recovery of hearing, while others may have permanent hearing loss. Early diagnosis and treatment are crucial to maximize the chances of recovery. Recent research is focused on developing more effective antiviral medications and immunomodulatory therapies. Stem cell therapy and gene therapy are also being explored as potential treatments for auditory nerve damage. Scientists are also investigating the role of inflammation in auditory neuritis and developing targeted therapies to reduce inflammation and promote nerve regeneration. There is ongoing research to find better ways to prevent and treat this condition.